Now I'm going to palpate for pulses. Any tenderness or pain?
No.
Okay, great. Now I'm going to listen to your heart and lungs. Lungs first. Breathe in through your mouth and out. Good job. Now I'm going to listen to your heart. You can just relax. I'm listening for S1 and S2 and making sure there's no adventitious sounds. You should just hear a good blub dub, blub dub. Listen for the apical pulse. You would listen for 60 seconds. You should also be able to feel the apical impulse about right here. If you will turn on your left side just a little bit for me. There you go. Okay, hold that. Okay. Now I'm going to inspect the abdomen, check in for the contour. It's basically flat. We don't have any distension or anything like that. Have you had a bowel movement today?
Mm-hmm.
Great. Now I'm going to listen. Listen for your bowel sounds. Okay. Now I'm going to percuss down. Should mainly hear tympany. Over some of the organs, you'll hear some dullness, and sometimes over the stomach. Okay. Now I'm going to palpate. Any pain or tenderness?
No.
Okay. Now I'm going to palpate deeply. And this is pressing a little bit harder. Any pain or tenderness there?
No.
I didn't feel any abnormal masses or anything like that. Right here, you can kind of percuss to feel the border of the liver. Usually it's not palpable and I can't really palpate his. Can also percuss on this side to get an idea about where the spleen is. And you shouldn't be able to palpate the spleen either. Good job. Okay, I'm going to move down to the legs and the pulses. First going to feel in the groin area for the femoral pulse. And feeling those inguinal nodes. Any pain or tenderness? Okay, I'm going to move to the popliteal pulse. The post-tib, and the femoral pulses. And they're all full and great. Also going to look for any edema in the legs. Going to push down. If there were some edema, it could be pitting when you lift up, and you would see indentions. Okay, now we're going to test your range of motion just in your hips and your legs. If you will, bring this leg all the way up to the ceiling as far as you can. Good job. And bend this knee and bring it towards your chest. Great. If you will, push up against my arms, against resistance. And here as well. Good job. Okay. Now if you'll sit up for me. I'm going to move the camera again. He'll sit on this side of the bed. So now we're just going to test all of your upper extremities. I just want you to pull them out to the side and above your head, behind your head, come together. Good job. Alright, and now push up against my arms. Good job. Alright, I want you to grip my hands. Grip, squeeze. Good job. Alright, and that's just checking to make sure that everything's symmetrical on both sides. His hand grip was good. That means he has good strength in both extremities. Okay, and now we're going to do your reflexes. Okay, so if you will, just rest your arm on mine, and with a hammer, I would tap here as well as here, and ask him just to relax and wiggle that arm. Okay, and these legs would be dangling. I'm going to ask you to relax. If the person can't relax, you could ask them to do this. If you'll just kind of pull, there you go. And it would tap with the hammer and elicit a reflex. Okay, now if you will, we're just going to test how well you can touch. So if you'll touch your nose and then to my finger. Faster. Good job. Okay, now hold both arms out and do one at a time. Faster. Good job. Now if you'll touch your thumb to each finger. Faster. Good job. Alright, now we're gonna, if you'll stand right here for me, I'm gonna move the camera again. Okay. If you will, I want you to walk heel to toe on the way. Okay, turn around and walk on your tippy toes. And then walk backwards on your heels. Good job. Okay, come back over here and turn around. I want you to lift the weight off one foot and then bend on it, the other knee. Good job. And the other side. Good job. Alright. You can have a seat. And I'm going to move the camera back one more time. The one thing we need to go back to is to test your thyroid. I want you to take some fluid into your mouth. Hold it into your mouth. I'm going to feel in your neck, and I want you to swallow when I tell you to. Lift your head back and swallow. Good job. Alright, and that concludes your physical assessment. Thank you so much. I appreciate your time.